weeks. Well, neuroimaging is debatable. What is the role of neuroimaging in traumatic of neuropathy? There is wide variation in practice. Some clinicians request CT or magnetic MRI or both for all cases. Others limit these interventions to patients with progressive visual deterioration, where the vision is continuing deteriorating, or when therapeutic interventions are being considered. Of course, as mentioned earlier in the one of the presenters, rule out metallic foreign body before you do MRI. CT is the best imaging modality for delineating optic canal fractures and their full extent in preparation for possible surgical intervention. However, the clinical usefulness of universal neuroimaging in TON remains debatable, as there is no consistent correlation between the finding of an optic canal fracture, the severity of visual loss, and the prognosis for visual recovery. So at the end of the day, what's the practicality of neuroimaging in all cases seems to be rather debatable. What are the now prognostic factors for indirect? A visual recovery rate of 40 to 60% has been reported for indirect TON, and those cases which have been managed conservatively. And with baseline visual acuity being the most important predictor. It is very important baseline. That's why it's, as I mentioned earlier, we have to be very vigilant in our clinical examination. Baseline visual acuity is very important, both for the prognosis as well as for the medical legal reasons. Other poor prognostic factors include loss of consciousness, lack of visual recovery after 48 hours, and absence of visual evoked response. What is the prognosis for direct TON? Of course, it's very severe injury, and it is really, and there is a very poor prognosis for almost all cases because it's irreversible loss, and was used within 3 to 8 hours of injury, an initial bolus dose of 30 milligram per kg, followed by an infusion at 5.4 milligram per hour for a total duration of 48 hours. So this was a mega dose. And the prognosis, the study, the major improvement, one of the reasons was a major improvement in this National Acute Spinal Cord Injury Study scores was motor and not sensory. Another landmark study option is surgery.